I did over increasing vaccine acceptance and rates, and then my name's Allie. So over this, we'll have a problem statement saying like what the workplace problem is. We're going to go over 5 different studies that I looked up and reviewed. We're going to go over a recommendation for evidence-based practice to help solve the workplace problem, and then like a PICO statement, and then we'll have a post discussion. So the problem statement is that parents are choosing to not vaccinate their kids. It not only affects the child, but those who are around them are susceptible to get the disease as well. And then this is supported by, there was a measles outbreak in 2015 that affected more than 20 states because a kid went to Disneyland that was unvaccinated and returned spread measles to everybody. So the number of children not being vaccinated is increasing. It was 0.9% in 2011 and 1.3% in 2015, and those are the number of unvaccinated kids at 24 months. They face negative outcomes. They face serious illness from the disease, disabilities from the disease, and then also death. So the first study is that vaccine decision making begins in pregnancy, and this one found a correlation between vaccine concerns and uptake. So the study consisted of 290 mothers, first-time moms, and mothers of multiple children. The surveys were in antenatal clinics, and it showed that first-time moms had more concerns compared to mothers of multiples. So 73% of new moms had decided to vaccinate, and 89% of mothers of multiples had decided to vaccinate. And only 2/3 of the mothers felt like they had enough information to decide to vaccinate. And a couple like different statistics is like the first-time moms, 15% of them were more worried about side effects, and only 9% were worried about side effects for the parents of multiple children. And then 36% of first-time parents were more worried about the number of vaccines that the children get in the first 2 years, and only 24% of mothers of multiples were worried about it. 16% of first-time mothers were worried about autism, and 9% of mothers of multiples were worried about vaccines causing autism. So we can use that information to address the hesitancy and give them the actual statistics of why we give the number of vaccines, so many in the first 2 years of life, and so on. So the second study is a childhood immunization education program for parents delivered during late pregnancy and then 1 month postpartum. So this study gave education on vaccines, like the side effects, what they're for, and all that, to parents late in their pregnancy. It was about a 10-minute education, and then they gave it at 1 month postpartum, which was about 3 to 5 minutes. There was 88 women in the intervention group and 87 in the control group, and the results that 72% in the intervention group were immunized compared to 43% in the control group were immunized, the children. And they also went into specific ones, so like the Hep B vaccine, there was 79% vaccination rate compared to 43%, and then the rotavirus, there was an 84% compared to the 68% in the control group. The third study is the impact of vaccination promotion intervention using motivational interviewing techniques on long-term vaccine coverage. So this was an individual education session using MI techniques over vaccines given at 2, 4, and 6 months to postpartum women. Motivational interviewing is a type of counseling to help patients find like the motivation to change. So the intervention group consisted of 1,140 mothers, and the control group was 1,249 mothers. In the experimental group, the rate of vaccine had a higher rate than the control group and had a p-value of 0.05. So the fourth study is increasing influenza vaccine uptake in children. This one's specific on influenza, but it could be used for all the vaccines. It was an intervention package to the group. It was concise education on vaccine and its side effects and other vaccine information. They gave a list of clinics that didn't charge above a certain rate to get the vaccines there, and then text message reminders. The control group just received like a public vaccine handout. And then the data analysis showed that the control group had a vaccination rate of 13%, and the intervention group had a vaccine rate of 38%. So this increased the vaccine rates by 25%. And the last study is effective community comprehensive nursing using scenario-based health education on the infant and young child immunization rates. So this is a scenario-based health education given to the intervention group. They had comprehensive education, an education manual, information over preventable vaccines, the types of vaccines that would be given, and any adverse reactions that they should look for. There's 49 in each group, and the data showed that there was a decrease in the delay of immunizations in the experimental group compared to the control group with a p-value of 0.05. And then my recommendation for evidence-based practice and PICO statement. So my PICO statement is basically saying how could this change. So in pediatrics, how does an individualized education given to the child's caregiver on vaccines compared to giving the parent a generalized education such as a vaccine statement affect the vaccination rates and acceptance? So I did the PDSA model for change. So the first step is we could propose a study to educate half of our new babies' caregivers individually at their first appointment, and then just give the other half a vaccine statement. And then the second step is we would do the education, and then we would look at the immunization rates in both groups in a pre and post test format. So we would study the rates before the education and then after in both groups. We would do a paired t-test that would be used to determine if the intervention group had a higher immunization rate compared to the control group. And then if there was an increase shown, then we would give the individualized education to all the new parents. And then here's the post-discussion. So, does this intervention seem appropriate for the workplace, and why?
I think it does. It increases vaccination rates. Gets more mamas to be doing vaccines with their babies.
How will it positively or negatively impact the nurse's obligation to provide holistic, culturally sensitive, or patient-centered care to the identified population of patients? I mean, we're getting people vaccinated, so it's centered around patients' health and safety. The legal and ethical implication for nurses who will be implementing the information, such as allocating resources, sustaining intervention, staff education. I think that would be like staff education because you got to know about the vaccines to educate on them. How will implementing the intervention positively or negatively impact the multidisciplinary team? I mean, it's more work because you have to educate more, but I think it's positive for the parents in the long run, so it would be good in the end. And then I went over the model for change and barriers to implementing intervention. Do you know barriers that would prohibit this?
I think just social media and things where parents are hearing things that probably is false information, but
yes,
they're hearing it from friends and other people.
And then advocates to involve in implementing intervention would probably be us vaccine nurses.
Yeah.
To do the change. Alright, and that's it.
Good job.